Welcome to this explainer. Today we're diving into something really massive, the true financial impact of medical fraud. We're going to decode the SASB accounting standard to see exactly how healthcare companies have to accurately disclose their total monetary losses when they get caught up in legal proceedings. I mean, when we talk about fraudulent procedures, manipulative billing, or illegal kickbacks, those numbers, they can get absolutely staggering. But how on earth does a company actually report that mess to its investors? Well, let's find out.
So think about it. How do you put a price tag on medical fraud? For healthcare providers, the financial fallout is enormous, and it goes way beyond just the initial fines. But for investors, the people actually trying to evaluate a company's real risk profile, fuzzy math just isn't an option. They need absolute crystal clarity on the financial impact. The stakes for compliance and transparency are literally higher than ever, which is exactly why standardized disclosure rules are so incredibly vital to the market.
Here's our quick roadmap for today. 1. The SASB healthcare standards. 2. Defining medical fraud. 3. The fraud disclosure metric. 4. Calculating total monetary losses. And 5. Context and corrective actions.
Okay, let's jump right into Section 1, the SASB healthcare standards.
Setting the stage here, the SASB standards operate under the stewardship of the International Sustainability Standards Board, or the ISSB, which is part of the IFRS Foundation. Now, what does that actually mean for us? It means we aren't just looking at polite suggestions, we're looking at a heavy hitter in globally recognized frameworks. These rules are designed to show how sustainability risks like fraud directly hit a company's cash flows, access to finance, and overall cost of capital. And right inside their specific healthcare delivery industry standard, there's a dedicated focus on fraud and unnecessary procedures. That is our playbook for today.
Moving on to Section 2, defining medical fraud.
What's great about the SASB standard is that it cuts right through the dense legal jargon and explicitly names the most common forms of healthcare fraud. We're talking about upcoding, billing for a service that's way more expensive than what was actually provided. There's unbundling, double charging, and taking kickbacks for patient referrals. It even covers incredibly brazen practices like literally charging for treatments that were never given or completely falsifying a patient's diagnosis just to justify an unnecessary procedure. Solely to generate revenue. It's shockingly audacious. But if an entity engages in this and gets caught, it triggers the exact reporting standard we're looking at next.
Which brings us to Section 3, the fraud disclosure metric.
The absolute heart of this disclosure is a metric known as HEC-DY 510.1, and what it does is mandate that a healthcare delivery entity must report the total amount of monetary losses they incurred during the reporting period listed out in their presentation currency. In other words, raw, hard cash in whatever currency the company uses for its financial statements. This metric totally strips away the PR spin. It's a raw, quantifiable number representing the exact financial impact resulting directly from legal proceedings tied to all those fraudulent procedures and billing tactics we just discussed.
Let's dive into Section 4, calculating total monetary losses.
Now, these losses have to stem from formal legal proceedings, but the standard defines this really broadly to capture the full scope of legal trouble an entity might find itself in. It includes any adjudicative proceeding involving the entity, whether that's happening in front of a traditional court, a government regulator, or an arbitrator. So civil actions from individuals, regulatory crackdowns from government bodies, and full-blown criminal actions, they are all completely covered under this umbrella.
When it actually comes time to calculate that final number, the boundaries are super strict. You must disclose all monetary liabilities paid to the opposing party. So that means the actual fines, civil judgments, restitution payments, and disgorgement, which is legally coughing up any of those illegal profits. But here is the absolutely crucial distinction. You strictly exclude the legal and other defense fees that the entity incurred trying to defend itself. You report the actual penalties of the fraud, not the massive lawyer fees you paid to fight the charges. This ensures investors are seeing the direct penalty cost, completely unclouded by variable legal defense budgets.
Finally, we have Section 5, context and corrective actions.
Because as the notes in the SASB standard point out, those raw numbers really don't paint the whole picture without some context. Entities are required to walk investors through a strict three-step checklist. First, state the monetary loss, calculated using those strict rules we just covered. Second, briefly describe the nature and context of those losses, like was this a jury verdict after a long trial, a quiet settlement, a guilty plea, or maybe a deferred prosecution agreement. And third, and you could argue this is the most important for the future health of the company, they have to detail the corrective actions they've actually implemented to stop this from happening again.
This is exactly where the company proves to the market that they have actually plugged the leak. The standard guides entities on what kind of corrective actions investors need to see. It is just not enough to say, we will do better. They must detail specific structural changes. Did they overhaul the management team? Did they change billing processes or sever ties with corrupt business partners? Did they roll out new compliance training for staff or install new tech to automatically flag unbundled charges and suspicious upcoding? The goal here is demonstrating they've learned their lesson and are actively mitigating future risk.
So to wrap this all up, how does transparency in medical fraud disclosure ultimately protect both the patient and the shareholder? Well, by forcing entities to clearly calculate and publicly disclose the exact financial impact of their misconduct, standards like this create a powerful financial disincentive for fraud. It arms investors with the truth, and ultimately, it pressures healthcare providers to focus on what actually matters, providing necessary, high-quality care to patients without the taint of financial deception. It's a really fascinating look at how accounting standards can actually drive better real-world behavior. Thanks for joining me on this explainer, and keep asking the tough questions.